Dr. Rochman, thank you for letting us sit with you at Advanced Vein Care Solutions. Just to get started, why should a patient care about venous disease?
It's funny, when I first started doing this, it was really difficult to get histories out of patients because a lot of venous disease it has very minor symptoms, and patients don't really know when the symptoms began because they didn't really think much about it. We now know that despite the fact that much of the symptomatology is minimal, even patients with just ankle swelling can have some potentially devastating changes going on in the tissues. The other thing is that patients don't realize it until they start to think about it, or until the symptoms become a little bit more severe, that gee, they may not go out walking because it hurts, or they may alter their lifestyles in certain ways because they're having some pain or some burning or some itching. Restless leg, for example. They may not want to go out in the summers and wear shorts because they're unhappy with the way their legs look. And although that may sound as purely cosmetic, it goes beyond that. It affects their entire lifestyle, affects their entire well-being. And when you put all these things together, I think that's a very good reason for patients to look at their legs, and if they're having problems, to go ahead and seek treatment if it's available to them.
When we're talking about vein disease, what is vein disease?
Vein disease is, for the most part, reflux. Because we stand upright, gravity wants to pull the blood back towards our feet, and the body and the veins are designed to prevent that from happening. There are valves in the veins, both deep and superficial, which prevent, when they're working properly, the blood from flowing backwards. Reflux is reversal of flow. Reflux is when the blood flows through valves that don't function properly back towards the foot, and then you have a situation where you have congested legs, you have unoxygenated blood that is just sitting there and can't get out of its own way, and the arterial blood trying to get into the foot, and that creates a very uncomfortable and sometimes dangerous situation.
What are the actual risk factors associated to vein disease?
If the foot and leg is congested with oxygen-poor and nutrient-poor blood, the tissues are not nutrified well, the arterial blood can't get in, the leg swells. If this condition is left alone for a long period of time, the tissues get thickened and brawny, and you can eventually develop a venous ulcer, which at its worst form can become cancerous.
So say there's some pretty big consequences if it's not treated.
Most patients don't have that disease that bad, but they do have pain, they have swelling, they have itching, they get night cramps, their legs feel heavy, they can't exercise, and many of them have enough discomfort that it really limits their lifestyle to a tremendous degree.
Who actually is more prone to vein disease?
Most of the population that do have vein disease are females. Of people who are over 55, about 50% of all those people will have some sort of vein disease. There are a number of predisposing factors. Heredity is a big one. Female gender, of course, as we just mentioned. Pregnancy, jobs that require that you stand in one place for a long period of time, not exercising your legs, not exercising the calf muscle pump, which is responsible for pushing a lot of the blood back towards our heart, and of course injury. Obesity is another predisposing factor, and in today's world is becoming a big one.
From your perspective, define Advanced Vein Care Solution.
We like to think that we are using the first-rate techniques. We like to keep abreast of all the changes that are going on in the field, not necessarily adopting everything, but evaluating the changes that go on, the new techniques, the new technology that's available, and picking from that what we think works best, is economical enough for the patients, and with which we can work comfortably. I do think that the non-invasive methods for taking care of both the greater and saphenous veins are pretty much the only way to go, except for very rare circumstances. Ambulatory phlebectomy, which allows us to actually remove long segments of ropey varicosities in the office under local anesthesia without the patient ever having to go to the hospital. One of the newer technologies that has come on the scene has been used in Europe now for quite some time, I believe about a decade, and it is targeted toward spider veins and telangiectasias. Up until now, it is clear from the studies that have been done that sclerotherapy is the gold standard, but this technique is beginning to rival that in the treatment of spiders all over the body. The only place that we know that lasers are better than sclero is on the face, and this new technique can treat not only the face, but spiders and telangiectasias anywhere.
Where do you see the industry going? How has it affected your practice?
Well, the advent of the non-invasive techniques has revolutionized my practice. In the beginning, when I was trained as a general surgeon, I did vein strippings And after doing a few of them, it became difficult for me to even offer them to patients. It was a barbaric procedure. It caused tremendous pain. And if I was going to be honest with my patients about what they were going to experience, which I was, they didn't want to have it done either.
So can patients actually expect to walk the same week?
Not only can they expect to, they are encouraged to, and in fact they must. Not only can they expect to walk the same week, they can expect to walk the same day. They walk in here, preferably with somebody to drive them home, although conceivably they could drive themselves home as well. The procedure is done here in the office under local anesthesia, and they walk out of here. We want them walking for about an hour or so every day for the first week, and the purpose for that is to drive the blood into the deep system where it's supposed to go in the first place and decrease the ambulatory and superficial venous pressure. So yeah, it's not only can they walk, they can work. There's really very little that they can't do right after surgery.
When I say words like results-oriented, what does that mean to you?
That's very important. I mean, results, yes, as long as they are the results that the patient wants and not the result that you want. I don't try to force my patients to make any specific decisions. I try and find out from them where they want to go, what they want their legs to look like, how much they're willing to endure, if that's a good word, and then work with them to accomplish that stuff.
Dr. Rochman, what would you say your overall difference would be?
I'm a people person. I love people. I like the technical aspect of surgical and medical care and vein care. I must admit, when I first started doing this, I was a little worried that it would be boring, and it's not. It's very varied, and I find it very interesting, and with all the research that's going on, it's even more so. But I really like dealing with people. I like finding out what they're all about. I like learning about their family and history, and I really enjoy making them feel better about themselves, putting them at ease. It makes me feel good.
You enjoy your job?
Very much so. I love what I do.
Dr. Rochman, thank you for taking the time to meet with us today at Advanced Vein Care Solutions. It was very informative, and I wish you and your staff all the luck in the world.
Victor, thank you very much.